SHIPSMP webinar. My name is Alanya Kasumu, and I am the Tennessee SHIP Statewide Volunteer Coordinator. This month is the National Mental Health Awareness Month, and our topic today has a special place in my heart as I studied psychology prior to becoming a member of the SHIP family. Sorry, everyone. Mental health is so integral to overall health, and I'm really excited to get into this presentation. Before we start, I just want to have another reminder to go ahead and mute your microphones. Everyone should be muted at this point, so you should be good. But for anyone else coming in, make sure to mute yourself and type your name and county of residence. If you cannot type in your name at the end of today when we do our Q&A session, you will be able to just go ahead and unmute yourself and let me know your name, and I'll go ahead and put you down in my records. But today we'll be discussing behavioral health care and the importance of the Medicare, what Medicare covers in relation to behavioral health and how to find behavioral health services. We'll go through a couple case studies and then we'll have our Q&A session. So let's go ahead and get into it. Oh, sorry, give me just one moment. So the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Because mental health is so essential to overall health and well-being, it must be recognized and treated in all Americans, including older adults, with the same urgency as physical health. The way I see it, we kind of are physical and mental health are two halves of a pie to make up a whole healthy person. I know we tend to do our best to make ourselves healthier, exercise, change how we eat, and things like that sort, take the medications we need to stay physically healthy. But sometimes mental health can so stigmatized and can be seen as less important as physical health, but it really is just two halves of the same pie. Without proper mental health, your physical health will suffer. Without proper physical health, your mental health will suffer. So it's really just looking at the whole self approach of it. It is just as important for an older person with symptoms of mental illness to seek treatment as it is for someone younger. I think right now the conversation about mental health is typically geared towards younger people, probably people in their 20s and younger. However, it is estimated that 20% of people aged 55 and older experience some type of mental health concern in their lifetime. That is about 1 in 5 adults 55 and older do experience some sort of mental health, and this was a kind of an old estimate. So due to things with the pandemic and other things, this number is probably just a conservative measure for the time being. So one thing we can do to help encourage beneficiaries to seek treatment to help dismantle the stigma attached with behavioral health issues. Having an open conversation about our mental health and our coping mechanisms can lead to others sharing and hopefully seeking treatment. So our main purpose here is just to start the conversation if a beneficiary has questions about mental health coverage or if they have any questions or if they are seeking treatment and just don't know where to start. This is just to help destigmatize everything and also provide resources to our beneficiaries. All right, so what is behavioral health care? So behavioral health care includes services and programs intended to help diagnose and treat mental health illnesses and addiction-related issues. So mental health illnesses, we're pretty familiar with that, is just conditions that affect a person's thinking, feeling, or mood. So some examples include depression, anxiety, schizophrenia, and bipolar disorder. Of course, this is not an exhaustive list, just a few for example. And then we also have substance use disorders and addictions. Those don't fall under the definition of mental illness, but they are considered behavioral health conditions. And people usually think of maybe opioid use, as we're in an opioid epidemic, and also alcoholism, but it can also be any substance that is abused. Behavioral health conditions typically are not the result of any singular event or circumstance, but rather tend to be complicated conditions involving an interplay of biological and environmental factors. So really just to break this down, people tend to think, okay, one thing bad happens and then people have like a mental health crisis, but it's not always the case. Usually it's kind of like it's a combination of both genetic predispositions and also the environment you raised in. So someone might go through their whole lives feeling generally mentally healthy, and then in retirement they might have something happen, or they might have a few things happen, or they just suddenly start to develop a mental health crisis, and things just happen at any age. It can present at any age. So as far as Medicare coverage, we have for Part A, the hospital insurance, it covers mental health services you can get in either a psychiatric or general hospital or rehabilitation facility that requires you to be admitted as an inpatient. So the costs for people with original Medicare are about the same as we discussed earlier this year with our cost tip sheet. There is that $1,484 deductible for each benefit period. So if someone goes in and they have an inpatient stay at a psychiatric hospital for 30 days, they'll still have that deductible. And let's say they do that in January, and then they also want to go to a rehabilitation facility in December that year. They will start another benefit period where they have to pay that deductible again. But other than the deductible, there's a $0 co-insurance per day for the first 60 days of the benefit period. And then it leads from day 61 to day 90. There's a $371 co-insurance per day. And then above that, there is a $742 per day co-insurance. And it also dips into those lifetime reserve days. But if you're needing to be an inpatient for longer than your lifetime reserve days, you will incur all costs of it. I just wanted to tag on there. While say you're in like a general hospital and you receive some mental health services, those will also be covered by your Part A benefit. As for outpatient care, that is covered by our Part B insurance, and it'll help pay for services such as depression screenings, individual and group psychotherapy, family counseling, if the main purpose is to help you with treatment, testing to find out if you're getting the services you need and if your current treatment is helping you, different evaluations, medication management, which we will get into in a little bit. It will cover prescription drugs that aren't usually self-administered. So if you need to go into a doctor's office once a month, every few weeks to have a certain medication administered to you, that will run under your Part B. It also covers diagnostic testing, partial hospitalization, a one-time welcome to Medicare preventative visit, and a yearly wellness visit. And Part B also will cover outpatient mental health services for the treatment of inappropriate alcohol and drug use. So it also covers a bit of the it also covers things like the opioid use disorder and alcoholism. So for the cost, you will pay nothing for your yearly depression screening if your doctor or healthcare provider accepts a Medicare assignment. And you'll pay 20% of the Medicare approved amount for visits to your doctor or other healthcare providers to diagnose or treat your condition. But the Part B deductible will apply. If you get your services in a hospital outpatient clinic or a hospital outpatient department, you may have to pay an additional copayment or co-insurance amounts to the hospital, but it's really just a place-by-place basis. Right. So if you have a Medicare Advantage plan, or the beneficiary you're speaking with has a Medicare Advantage plan, the plan must cover the same mental health and addiction recovery services as original Medicare, but they may impose different costs and restrictions. For the most accurate guidelines, I always recommend just contacting the plan directly. They'll be able to give you details about how much a therapist visit might cost or how much a visit to the psychiatrist may cost. Right. So let's get into addiction recovery services. Medicare covers treatment for alcoholism and substance use disorders in both inpatient and outpatient settings if your provider states that the services are medically necessary, you receive services from a medically approved provider or facility, and your provider sets up your plan of care. Covered services include, but are not limited to, patient education regarding diagnosis and treatment, psychotherapy, post hospitalization follow ups, substance use counseling, individual and group therapy, toxicology testing, intake activities, and periodic assessments. And let's get in. Okay, so next up, we have this opioid treatment program. So Medicare Part B covers opioid use disorder treatment received at opioid treatment programs. OTPs are certified by the Substance Abuse and Mental Health Services Administration to provide methadone as a part of medication assisted treatment. Methadone is, for those who don't know, methadone is a medication that works to kind of antagonize opioid use in your body. So it tries to deter cravings for opioids. It also will lessen the effect of opioids if someone is on methadone and tries to take opioids, trying to just deter people from opioid use, essentially. And in order to receive Medicare coverage for OTP services, the OTP must be certified by SAMHSA, sorry, and enroll in the Medicare program. So for drug management programs, these are things that Part D companies use to limit at-risk beneficiaries' access to certain drugs. So sometimes you might get a call from someone saying, oh, my plan doesn't let me use all of my hydrocodone each month. They're probably running into these drug management program issues. So these plans use clinical guidelines to identify beneficiaries who are at risk for misuse or abuse of frequently abused drugs, such as opioids. They also could be benzodiazepines. Well, usually what will happen is if someone goes to their pharmacy to pick them up, it'll say, oh, this person has gotten this many, or their dose is a little too high on this. Let's make adjustments or let's check in with the provider before we dispense the medication. So at-risk beneficiaries may be required to use one provider and/or one pharmacy to get flagged medications. This is known as a pharmacy or provider lock-in. That's also an issue beneficiaries may run into from time to time. These kind of things, they're limited to just one provider, usually a recovery center or like a drug management or, sorry, who knows, some kind of facility to help with drug management and pain control clinics and things of that sort. And they also might be locked into one pharmacy. So they cannot, unfortunately, be in both, and they won't be able to go to a different pharmacy to fill their prescriptions. They wouldn't be able to go to a different doctor and get prescriptions from a different doctor since they're locked into a certain provider and pharmacy. And if a beneficiary is identified as at risk, they'll receive 2 notices from their plan, sorry for the typo, with proposed coverages, with preferred coverage limitations and time frame in which to submit information back to the plan. So if someone's at risk, they'll get a first notice. It usually will detail, this is what your coverage limitations are. These are what we need from you. You need to provide information on who your primary provider is. You need to provide information on who your primary pharmacy is. And then they'll also give you a certain time frame in which you have to send all the information back for your plan to continue to cover your medications. One thing I did want to touch on is outpatient mental health care fraud. This fraud usually occurs when Medicare is billed for mental health care services that you did not receive. You can report fraud or errors to Lonnie Hitchcock, our Senior Medicare Patrol Project Coordinator. Lonnie is amazing. And many of you are also familiar with Lonnie as we switch off each month with these webinars. But some examples of mental health care fraud include spending a day at a facility playing games or watching TV, and Medicare is then billed for your group therapy or group psychotherapy. You and other beneficiaries are picked up by a bus or a van, taken out for a meal, and then Medicare is billed for psychiatric evaluation. Or you see other incorrect charges on your Medicare summary notice of explanations of benefits, such as mental health services in excess of what you received or that you never received. So if a beneficiary calls and they say they're getting charged for Medicare, they're getting charged for certain services that they didn't receive, it's always a good idea to check in with the provider first and foremost. Maybe they had a billing error on their end, but if they insist that the error is incorrect, we can get Lonnie involved and we can, sorry about that, investigate what the issue might be and go from there. But fraud does exist with this type of thing as well. In regards to finding different behavioral health services, you can receive services from any of the following type of providers. Psychiatrists, however, are more likely than other types of providers to opt out of Medicare. So if you were to see an opt-out provider, the provider must have you sign a private contract stating that you will incur all costs associated with the treatment. When I was researching this, they didn't provide like a reason why the psychiatrists are more likely to opt out, but I would assume just for like cost reasons to like support their practice. But it's always just a good idea to double check with the provider before you start your service, whether they accept Medicare and accept assignment. But if you, to help a beneficiary, or if you're just interested in looking and seeing what providers are covered with Medicare, you could always, I always recommend starting with a referral from your primary care physician. And then from there, there's also the provider compare tool on medicare.gov under providers and services. You can search through there and find a psychiatric or psychological provider in your area. And you can also, if the beneficiary has an Advantage plan, contacting the plan for a list of in-network providers. There's also some national resources that we could use. We have, of course, the Substance Abuse and Mental Health Services Administration, I mentioned earlier, but there's also the National Alliance on Mental Illness and the National Suicide Prevention Lifeline. I have all of their phone numbers, an email for one, and a website, but all of them can be found online as well. So we are speeding through this presentation. Sorry about that, everyone. But we do have a case study. So this first question, Lucinda has a monthly hour-long individual therapy session with a psychiatrist who accepts Medicare insurance. When she receives her Medicare summary notice in the mail, she sees that her Medicare coverage was billed for 2 of these therapy sessions per month, each lasting an hour and a half. Her Medicare was billed for a total of 3 hours per month rather than 1. Lucinda is certain that she never visited her psychiatrist more than once per month or has had sessions lasting more than 1 hour. Would anyone like to unmute and say what Lucinda should do in this situation?
This is Nancy Parker.
Hi, Nancy.
Hi. Number one, I'd tell her to call the provider and verify the date she was seen and the length of the visits, get their input on it, and have her address it with them. And again, depending on the outcome of that call, to notify Medicare. Maybe depending on, again, the outcome of that, she may need to bring in Lonnie to get all that straightened out and determined, because it all goes by coding, and it may simply be that some of the services were coded incorrectly. But I'd say start with the provider first and then gradually go up the chain.
Yes, definitely. Thank you so much, Nancy. You basically hit everything I was going to say. Of course, contact the provider first, and then if depending on the information they provide you, if the situation is not solved, go ahead and contacting Medicare and contacting Lonnie to go ahead and get that process started for the investigation, and so we can just figure out once and for all for what the billing error might have been. Sorry. All right. We have one more. This one's a little bit shorter. Penny wants to begin individual therapy with a psychiatrist or psychologist, but she's not sure where to begin and how to make sure Medicare will cover her care. What would you suggest to Penny to do? So let's get someone other than Nancy to answer. Not everyone else. She should definitely call SHIP, definitely. Thanks, Tina. Okay. Does anyone want to answer? Anyone before I give it away?
Go to Medicare.gov.
Yes, definitely.
.gov.
.gov.
And also check with the therapist or psychiatrist, psychologist to make sure that they accept Medicare.
Definitely.
I always recommend, be it mental health really or anything else, that the best place to start is with your primary care provider.
Mm-hmm.
They know what's in the community, know what's out there, may or may not know what doctors take what plans or original Medicare, but they at least can give you some good initial suggestions. And of course, you provided those resources earlier that are also good. But start with the primary care doctor. You could even contact a local hospital or something, and frequently they will have lists of providers and what plans they accept and that sort of information.
Definitely. Yeah, best choice of options is start with what you have. Contacting your primary care physician, maybe the hospital system in which they work or associated with, asking people in your community if they have any mental health specialists that they see regularly. Of course, trusted people in your community. And also, if you want to just go on a more private route, contacting Medicare, like calling 1-800-Medicare.gov or 1-800-Medicare, going to Medicare.gov to find a list of providers in your area, contacting your Medicare Advantage plan, everything of that sort, and also contacting those other resources I put in the slides earlier. Any of those will be a great starting point into finding someone to help assist you with your mental health needs. And everyone, I rushed through this presentation today. I do apologize, but that is what I have. Does anyone have any questions for me? I will pull up the chat now and see if there's any questions.
Hey, Elaine.
Yes,
It's
ma'am.
Lonnie. Hey, the last issue I had with anything dealing with mental health is that I had a hospital trying to balance bill a QMB individual.
Oh,
So just FYI, they were trying to balance bill her for the Part A deductible.
gotcha.
So that's some of the latest issue that I've dealt with.
Mm-hmm. Do you deal with a lot of like mental health issues, or is it kind of rare?
Yeah, it's rare.
Gotcha.
Most of the ones that I've dealt with have been like balance billing issues. I've really not had any counselors or anything like that. Not billing correctly or coding stuff incorrectly. I've never really had anything like that.
Mm-hmm. Gotcha. Okay. Oh, well, thank you. Let's see. Had a question from Mike would Alzheimer's or Mike Lee, would Alzheimer's or dementia be included in any of this? This particularly, I don't think so. I think that's just it's going to be covered under your Part B benefits just for your regular medical insurance. It's not specifically mental health, but yeah, it would still be covered, like coverage for it, depending on where they go, would still be covered, but it's not exactly mental health. If that makes sense. Does anyone else have any other questions? Feel free to unmute yourself. Well, alrighty. I'm sorry, guys. I guess we had a quick little presentation this morning, but I'm gonna go ahead and turn off the recording. Let's do that first.